Hello and welcome. I'm Barkha Dutt. You're with the Mojo story. The big story today, while the rest of the country still has a vaccine shortage, at least in terms of India meeting its December targets, the irony is this: in many parts of the country, we are actually looking at an underutilization of vaccines, especially when it comes to private hospitals. Let's take a look at this very ironic development. Vaccine underutilization in private hospitals is a worry. This is now coming straight from the health ministry, even as several chief ministers are also sounding the alarm on this. Why is this happening? That is what we're going to explore in the program today. In fact, the ministry is saying over 2.75 crore doses are unutilized by private hospitals and states. This is something we do need to examine. Why is this happening? This is happening even as Delhi is issuing an order reserving stock for second doses instead of someone who's looking to get their first jab. Three different chief ministers have already written to the Prime Minister saying there should now be a change in rule, and the 25% allocation for the private sector should be reduced. Some chief ministers are arguing that it should be reduced to as low as 5%. How do we make sense of this ironic situation where we have gone from shortage to wastage? Tamil Nadu, which is also asking for a reduction in stocks, is in fact providing vaccines for free, even in the private hospitals where they are in fact administered at market rates at the moment. Let's introduce our panel of experts today as we look at this all important question. We're joined on the program by Dr. Sonia Dalal. She's a pulmonologist joining us from Vadodara today. We're also joined on the program today by Dr. Jaleel Parker, who's with the Leelavati Hospital in Mumbai. Dr. Harsh Mahajan with Mahajan Imaging runs private laboratories that do perform both the tests and the vaccine administration. We'll talk to him about why there's a wastage. And Dr. Lancelot Pinto, who's with the Hinduja Hospital, joining us from Mumbai. Harsh, let me start with you, and my question is this: you had flagged this on one of our earlier programs that you couldn't understand why this was happening. Why did the private sector have more vaccines than were being used? You suggested, and you still might believe that it's the price, but I have seen, in the course of reporting this story, extremely poor families taking loans, mortgaging jewels, selling farmland to pay very, very steep bills in private hospitals, in organizing injections, whether it was remdesivir or tocilizumab. Why would they then hesitate to pay, let's say, under 2,000 rupees for a vaccine? Does the price or the cost explain it? And how severe is the underutilization?
Thank you, Barkha, for having me on the show. Now, there is not only one single factor which you can lay your finger on as the reason for the underutilization of the vaccine in the private sector. I think vaccine hesitancy still is a major problem, especially as the number of cases, new cases on a daily basis go down. The fear of the disease also tends to go down. And the surge which we had seen in vaccination during, say, April, May, even June, I think that has gone down as the numbers have gone down. And especially if you see the number of fresh cases, it's a very uneven distribution in the country. And it's a few states where you have most of the numbers coming from. Delhi, for example, has a positivity rate on the RT-PCR of less than 0.1%, and the number of fresh cases is only in double digits, 45, 50, 60, like that. So one reason is that. The second reason is also that the government has been advertising, both the state government as well as the central government have been advertising their free doses very extensively in media. And that's also a reason that remember that there are only a few percentage as far as rich people in this country are concerned, maybe 5%, 7%, who can afford it and not think about the
But then,
cost.
but then, how do you explain that extremely, poor people? And I have met with them. They took bank loans, they sold their field land, they mortgaged jewels. When it came to organizing treatment in private hospitals, now if you just look at the cost of these vaccines, yes, admittedly, 1400, 1500 rupees is not a small amount for somebody, especially given the state of the economy, somebody who doesn't have a regular income, but it is much less compared to what they'd have to pay at hospital. And I don't know why this money is not convincing me as a reason.
See, it's an absolutely different situation when you look at someone who's sick, very sick, and needs hospitalization. Then they do sell things and come to private hospitals. Unfortunately, the number of beds in the public hospitals are few, and also the care at times may not be the same what you may get in a tertiary care private hospital. And that's why, this is the Tina factor. There is no other alternative, there is no choice. Whereas for vaccination, it is something which is preventive in nature, and that's why they would rather wait. This is my feeling. They are willing to wait a week, 2 weeks, 3 weeks, when in their neighborhood, in a school or in a hospital which is run by the government, this dose will get available. And this I really feel is the reason why before this regime came into place, we had placed an order for 30,000 doses, and ours was one of the first labs or diagnostic centers where we started giving it. And I think we got it around the 14th or 15th of June. We are still left with 20,000 plus doses. We are on an average on taking two locations, we are giving about 250 jabs a day. And so there is the price, I'm sure, playing a factor, because we've seen all over media that there have been stampedes at places where it's given free in the public sector, and there are huge crowds. In fact, the public sector has had to close some centers because of the fact that the vaccine was not available. So that I think the price is an issue as compared to 250 rupees, which it was earlier. It is now 780 rupees for Covishield and 1410 rupees for Covaxin. If
Yeah.
it's two adults in the family or four adults in the family, that's a substantial sum. And I think the price is a factor.
Okay, so price is the factor. You also seem to suggest that there isn't an immediate panic in many cities, and that's why people aren't rushing to hospital. I just want to get a sense from the doctors in the other cities whether they're seeing this in their hospitals as well. Dr. Parker, are you seeing this in Mumbai? Is this your experience that vaccines are in fact going waste? That we're in this very ironic situation where we're actually not administering the 8 million doses a day that we need to meet the December target of vaccinating all adults, and at the same time in private hospitals vaccines are going a begging. Dr. Parker?
Uh, Barkha, I totally agree with what Dr. Harsh has said, but I would like to add certain more points. What has happened is that when we started giving vaccinations, I mean, the authorities, when they started giving vaccinations to the private hospital, there were certain caveats along with it. For example, initially we started with senior citizens, then we said, no, prior to senior citizens, it was only the health workers. Then they said only senior citizens. Then they said 45 to 60. Then they said below 45 also. And then suddenly there was the availability of vaccines was not there. So there was a break. I totally agree that it is the cost, because many of the poor people, they are waiting to go to these charitable institutes or philanthropists who have started this vaccination. So what happens is they go over there. Now, if the doses are over, they have to wait for a couple of days because the vaccines were not available. So it's a conglomerate of various issues. It's not just one. Now, when they are saying that we should be reducing to the private hospitals, I would like to understand as to why. So the cost is one of the factors. If people can't get those doses free, everybody cannot afford. So there is an issue, and when these people come to the private hospitals, then we say, no, we cannot, we are not entitled to. It's not within our purview. The government has to, get rid of the caveat. Only then we can give. So everybody is actually confused, and that is why we find that vaccination. You think nobody would come to a private hospital? They would
So
prefer private
are you
medicine
saying more
given
than
for free.
are you saying more than the cost? It's been the flip flops in the policy, and there is not enough awareness even now about the vaccines. I mean, is that your explanation, Dr. Parker?
all like all agreed upon everything that you're saying. And there's another issue, be it whichever religion, there is a particular percentage of every religion that they say that this vaccine is a hoax, COVID is a hoax. We have not got over it. It is still going on everywhere. It is going on even in the remotest of villages, and even in the cities. In the cities, they don't want to. They say, no, no, this is all nonsense. They only understand when they are near and dear ones, they die or they become critical, when they are on ventilators, and when they have to spend a lot of money, not only on
Yeah.
in the stay of the hospital and including the treatment.
Yeah. So let me just get a quick response from the other doctors. Dr. Mittal is with us as well. But Sonia, I'll come to you, and then to Dr. Pinto, and then to Amrish. Sonia, what are you seeing in Gujarat? Is it similar?
So I'll take just 5 to 10 minutes, Barkha. It is always said that when there is a fire, you run for the water. So as I agree to Dr. Mahajan, now that there is reduction in the cases, the hesitancy to go and take a vaccination has gone down significantly. And of course, there are a lot of issues related to superstition, ignorance. There's a lot of anger amongst the people. And there was a recent paper that, people in Dharavi are completely angry because of the loss of their job and all those things, which they are probably correlating. And there are a lot of issues going on with their multiple awareness programs have been conducted for
Right.
giving them vaccinations. And also, of course, I do agree that discrepancy in the price. So, when you have different pricing caps, you always have that detrimental effect on the public health. And then, the shortage of the vaccine, and the procedure, 50% is allocated to the central government, and then the 50% is then siphoned off. And then you have to divide that which state has to be given the vaccination. It all depends on the number of the cases that the cases that the state is saying. And also then it is allocated to the health private sector.
So what are
And then
you seeing? So what are you seeing on the ground in Gujarat? Are there more
in
vaccines?
in the private sector where I work, Barkha, I haven't seen much of the wastage per se, but we see shortage, of course. So if my hospital has applied for the vaccine, it comes as a consignment after 21 days. So when you apply on the COVID app, you get it after 21 days, and then within that, within a week itself, the whole thing gets
So
over.
this
So
is
have you
this
seen
is what is
wastage?
confusing. So hang on, Sonia, I'll come back to you. I want to get Dr. Pinto and Dr. Vittal in. This is what's confusing, that some private hospitals are still talking about a shortage, but in general, Dr. Pinto, we now have chief ministers of 3 states, perhaps more, saying we don't want so many vaccines for the private sector. There are other states that are considering using CSR funds from private corporations to actually pay for. So the state will then, for the end user, that vaccine will be free. But I just do not understand why there is a difference between, for example, how testing really acquired momentum once the private sector got involved, but the same has not happened with the vaccines. Dr. Pinto, why do you think that is?
So thank you for having me on the show, Barkha. Just before the show, I contacted our guys here to find out what the status at my hospital was. And we were doing over 1,000 vaccines a day. And apparently, most of the slots were being filled up, barring the past 3 or 4 days because of inclement weather in the city, which I think has caused a dip. So I don't think that we have been falling short of the number of people who should turn up. I think it'll be interesting to know how many people are coming for the second dose versus the first dose. If the number of people who are now coming seem to be predominantly the second dose, it would be a reflection of those people who committed to vaccination during the surge and therefore felt a need. and those who haven't committed yet are probably not coming in for their first dose. So I think it's an important distinction to know the percentage of people who are actually doing the second dose versus the first dose. Regarding allocating vaccines to the private sector, I mean, I'm not a public policy expert, but I think this could be a dynamic process based on what gets utilized. So every week you can possibly allot a certain number of vaccines to a hospital based on what their consumption in the week prior was, rather than have an absolute number like a 25% or a 75%. I think the dynamic process like that would make more sense to me than, committing to a certain amount and then feeling that that's not being met. The third possibility also is that maybe people are a little reluctant to come to a hospital to receive a vaccine. And I think a lot of the private vaccination seems to be happening in hospitals. That wouldn't apply to laboratories and other situations as well. And maybe there is a slight reluctance to come to a hospital, given the fact that a lot of spread was attributed to the crowds coming towards vaccination centers.
But then they're going to, but that's not happening in the government hospitals. So there's some paradox here that we are not able to crack, right, Dr. Pitto? And I'm wondering, and just because it's related, we are the only country which at 35,000 cases a day will say that actually it's because the cases are coming down. The cases are still sizable, the deaths are still significant. I don't mean in terms of any policy prescriptive of lockdown or anything, but I'm saying they're significant enough for people to try and get a vaccine. So I'm just wondering if this is an urban-rural divide. We actually need someone to break down the data further, Dr. Mittal, and possibly look at whether we're now looking at a second dose phase in the cities. I'm wondering if that's explaining what's going on here, and the divide is actually rural-urban, because certainly in villages I've traveled to, villagers are loath to going to hospitals, whether it's government or private, because the hospitals aren't close enough. So they have to travel considerable distances to get to hospitals. Dr. Mittal, what are you seeing in terms of underutilization?
So thank you, Barkha. I think the one important part is, and again, this is a very rarefied sample, that in our kind of hospitals, most of the patients who are coming are actually vaccinated now.
Yeah.
They have had at least one dose, if not both. Or so one of the reasons why people's vaccines are delayed right now is that in Delhi and surrounding areas, almost everyone got COVID in that period. So that puts them off by 3 months. So I expect that a larger number of people will again turn up towards the end of July and end of this month and in August. That's what I expect. Second is that the Covishield gap is also quite long, 3 to 4 months. So people who've taken their Covishields and coming for their second shot, so this phase may appear a bit dull. But I do think that vaccines, people are coming forward for vaccination. There is no question. Hesitancy is there, but is very low in this kind of educated urban environment that we are talking about. And your point about the urban-rural divide is probably very, very true. And within the cities also, there will probably be divides in different kinds of socioeconomic structure. Definitely, the point about reluctance to come to hospitals still applies. People are, and because there is some truth in that. Because when people got their shots in mid-April, early April, a lot of them got contracted COVID 4 days, 5 days after visiting the vaccination centers. Now, we can't prove whether it was through that or not, but I know personally of at least 2 dozen people who contracted this, my own friends and colleagues who got it, 5 days after, and the period is too typical to be dismissed.
Yeah.
So that is there. And of course, the cost makes a difference.
Yeah, I'm just really confused by this, because I mean,
Yes.
the cost of the vaccine just doesn't compare to the cost of the treatment or the cost of paying a hospital fee. And even if you get treated in a government hospital, by now I think word has spread. People have seen those images of, despairing people at crematoriums, all talking about having had to sort of lose everything, their life savings over this. Dr. Mahajan, I want to understand, when you have a surplus stock, what happens to it? Do you return it to the state? Does it go waste? There are some countries where basically at the end of the day, they have a walk-in phase. So, for example, they'll sort of go and say, like, if the vaccines are only for, let's say, 25 to 44, I'm just using a random age group, they'll say at the end of the day, whatever surplus is left, anyone can walk in and get the vaccine, even if they're not qualified to get it. So I want to understand whether something like that would help, what you do with the surplus, does it go waste? What's going on with the surplus?
Point number one, nothing goes waste because the duration for which you can store it is very, very long. So even if it takes several months, it's stored at the necessary temperature. And so not a single jab will go waste. So, this headline saying wastage, I think it is not wastage at all.
So what
Point
is
number
it?
two.
Would it be fair to say it's slowing down the vaccination rate? Would that be the more
Yes,
accurate description?
yes, that would be more appropriate because what is
Yeah.
happening, we've got the vaccines with us, which we are unable to actually put into the arms, whereas there are others who are waiting to get the jab, and because of unavailability at times in the public sector, they are unable to get it. So that is where the inequality is there, but nothing is getting wasted. Ultimately, all of them will go in. Point number two, I agree with Dr. Mittal when he says that the long duration, the 84-day duration between the first and the second jab, also means that those who've had their jab in, say, May, June, are not going to be coming now. They are going to come only after 84 days to get the second jab. And third, one thing right now is that there is no methodology by which I may say I have 20,000 doses left with me, and there are some hospitals which have lakhs of them lying with them, and that we can actually give it back to the manufacturer or to the state government, and they can, distribute it through the public channel. That I think is something which, if permitted, these jabs will go back into the public system. We get reimbursed
Yeah.
the cost we had paid, and these jabs could go in much quicker into population at large, because it's not right that there are doses sitting
Yeah.
in refrigerators, whereas there are people waiting to get them. So this is one
Absolutely.
thing which can be thought of.
So I want to actually now turn my attention to what should happen. So one suggestion coming from you is that the private sector put these vaccines back in the public health distribution system. But I'm just wondering about the logistics of that. The second more controversial question is, should the private sector just get much fewer vaccines? Chief ministers like Naveen Patnaik are arguing instead of 25% allocation to the private sector, make it 5%. Dr. Parker, do hospitals need, private hospitals need fewer vaccines instead of more vaccines at this point?
No, I don't think so. I totally agree with my previous counterparts over here, the panelists, my colleagues. See, what is happening is that we are, once again, have flip-flop in regards to the duration of the vaccine. First, you said that on the 28th day you could take, then you made it to 45 days, you made it to 64 days. Now you have 84 days. Now there are people who are eager to take their second dose of vaccination, but they are unable to do so because of that 84 days caveat that is there. So you can't get into the system, and you cannot get yourself the second dose vaccinated. Number two, what is most important is, because the wave has now gone down,
Yeah.
people are a little again lax in taking vaccinations. The irony of this whole issue is, I'll tell you, Barkha, one of my friends who is giving vaccination for free in memory of his daughter who passed away. Now he has to hire doctors, nurses, paramedics, everybody at the center where he's paying everything. Now, he told me the other day that now there are no vaccines coming in for 4 days. So I can't give, but I have to pay these people. But just because he is doing it in the memory of his daughter, he is, insistent that I should be generous and give enough to as many people as possible.
Yeah.
I don't understand, why are they saying that the private hospitals do not need so much of percentage? That means there is something which is wrong. There's a spoke in the wheel.
So the
If
spoke,
the
Dr.
private
Mahajan
hospitals
believes, is the
are,
pricing.
as
Dr. Mahajan
Dr.
believes the
Mittal
spoke is
rightly
the
said,
pricing. See,
sorry.
one theory could be the pricing. The second theory could be that in the cities, in the class of people who can afford to pay for their vaccines, most people have already got their first jab and are possibly waiting for their second jab. But in the meantime, we're slowing down the rate of vaccination for the rest of the
Absolutely.
country. So this number of 25% certainly has to be dynamic. Yes, Dr. Parker, you want to add something? Yeah.
Right. I'll just take a minute. Right, Dr. Mittal said that there is something wrong in the system. Why can't we give these vaccines, if at all that the vaccines are in excess? Why can't we give it to the others? Yeah, in the rural areas, I don't think everybody is getting the vaccination as of now still. So what are we talking about? I really don't understand what is the intention of saying that vaccinations should be reduced to the private hospitals. Is the government, I mean, all these chief ministers who have
Because
spoken.
in not reducing it, you're slowing down the use of those vaccines for others. Harsh, you wanting to react briefly, and then I want to go to Sonia. Yeah, Harsh, can we? Yeah, Harsh.
Yeah, just a quick one. Just on the fact that 25% is the number that the government has kept aside for the private sector, but there's a dynamic process already in place on the COVID app based on
Yeah.
how many jabs you are able to give. Or previously, in the previous month, in the previous weeks, you can only get a certain percentage more in the next month. So that aspect is being taken care of.
Right. Yeah, I get that. But, we're still grappling with this really ironic situation where there are these vaccines stacked up in centers like yours, Dr. Mahajan, waiting for people who are not showing up. So maybe in 2 months from now, you'll still need the same volume that you're getting right now. But perhaps in these 2 months, you don't, which is why I'm saying the system has to be much more dynamic. But let me be more controversial and say, ask the following. Should the private sector be taken out of the vaccine distribution system? Should it be done only through government hospitals? Sonia?
No, not at all. I still believe that private has to chip in, private has to take part in the vaccination program. I just don't believe that it should only go to the government, because private is also doing a very good job in the unless you get the stock at the right time. I mean, what my hospital is still suffering is that getting the stock at the right time, and we always have a stock issues. It comes after 1 month, and there is always a distribution issue. So I still believe, and we have a lot of waiting list in the private till date, that patients want to come to the private and take a jab rather than going to the government institution.
So then there's another question, and it's being asked, by governments in certainly parts of the Western world. For example, Dr. Pinto, we have Macron now saying that there will be vaccine mandates or a self-paid negative RT-PCR test if people who are unvaccinated and are declining to get a vaccine want to go into a supermarket, into a gymnasium, into a bar, into a restaurant. This is, of course, designed to take on those who are anti-vaxxers or who are just too lazy about getting vaccines. Is there, I know that in India we're not there yet because the distribution of vaccines is so uneven, but is it time for vaccine mandates? Is it time for vaccine mandates, at least with some economic activity? So let's say you want to get into a gym in your city, you've got to show that you're double vaxxed. You've got to get onto a plane, you've got to show that you're double vaxxed, or you've got to go and get an RT-PCR test, one of the two. Is it time for that? Would that change the complacency among those who aren't reacting with urgency?
So I think that's already being done. If you look at least the city of Mumbai, for example, the RT-PCR requirement has been lifted off flights as long as you have both your vaccines in place. And I think, there's one way of looking at it. It's not so much of a disincentive, but it's an incentive, at least for frequent flyers there. But of course, that still represents a very small proportion.
Very small number, yeah.
Of the entire population. Now, whether we take that further, it'll be discriminatory to do that if we can't ensure that everybody gets the vaccine when they want it. So you can't on one hand say that there is a person who's willing to get the vaccine, but there's a shortage, and at the same time you're penalizing him or her in some way for not receiving it. So as long as we can ensure that whoever is willing to take the vaccine gets it on time, gets it conveniently, I don't see anything wrong in preventing or disincentivizing or incentivizing people who want to come in communal settings to be
Yeah.
vaccinated, or kind of not allow them in communal settings? Because that's the concept of a collective good in any case, and we do that in a lot of different ways.
Yeah, but given, in India, the problem with the vaccine mandate is that the argument would be that overall there aren't enough vaccines, Dr. Mittal, right? So at the moment, if you were to impose a mandate, people would say that in the absence of equity, it's not fair. But there are certain city community activities that maybe maybe we can't chase this utopian idea of equity, and maybe we need vaccine mandates to pace up those who aren't getting vaccinated.
Yes,
Should the
Barkha,
vaccine be compulsory? In other words, let me say it in simple English. Should the vaccine be mandatory or compulsory?
mandatory for.
For most economic activity, not to sit
So
in
the
your
thing
house and harm nobody. But as Macron said, it is the unvaccinated who should stay at home, not the vaccinated. So the vaccinated should no longer be punished for those who have access to a vaccine but are refusing to get vaccinated.
So the challenge, as you already pointed out, Barkha, and that will be who have access. How will you implement this? Except in certain very high-end areas, it'll be difficult to implement because not everyone has access to the vaccine. There are shortages. My colleague spoke about it. Unfortunately, it seems like in everything in India, there are a lot of discrepancies and differences between different regions and different hospitals. Like, I don't think Harsh has a shortage of vaccine. I don't think Max has a shortage of vaccine. I don't think Apollo has a shortage of vaccine. But we also have to realize two little points here. Number one, these very large hospital chains have a lot of reach, but their reach is still to a particular class of people. The reach of these hospitals is not beyond that class of people, whether we like it or we don't like it. And then, even if we do see patients from those sections of society, it's when they are very sick. That's a different story. When you're very sick, you'll go to any hospital, right? But when you're not sick, you're going for a preventive sort of measure. You may go there for COVID treatment, but you're reluctant to go to a hospital because it's not really within your normal sort of ecological system, that particular hospital. So I think there is a difference in reach. The government reach cannot be compared. I mean, there's a huge difference. In the other thing, small point, technical point, is that because of this long gap of Covishield, which scientifically and technically may be all right, a lot of people now want Covaxin. All the youngsters I meet want Covaxin. They say,
Really?
because
Yeah.
if you have to go somewhere, whatever it is, I don't want to get stuck. I want both the shots in quick succession. And then Covaxin is actually in short supply in most places.
Yeah, the volume of Covaxin, even the government's own affidavit in the court tells you that Covaxin has missed many of its production deadlines. Now, in final comments, what should happen? I am arguing that this 25% has to be an elastic figure. Harsh, the other suggestion, and I'll start with last comments. Okay, Sonia, I will start with you. What should happen? Make a concrete suggestion. Should the allocation come down? Should the government pay for the cost of the vaccine, even in the private sector? Should all vaccines be uniformly free? I don't know, where the government is then shouldering that cost. You're now going to get in imported vaccines as well. Where are they going to be marketed? I mean, there's so much confusion. Sonia.
Yes, Barkha, so I would like to, 35% of the people are from the rural India, and
Yeah.
most of them don't have access to the internet, nor do they have access to the
COVID
COVID
app.
app. Yes, so I would rather think of, giving them, encouraging them, creating a lot of awareness programs for them, encouraging them to come and take a vaccine jab, and then issue the vaccine cards. I still remember, as a child, we normally give a pediatric vaccine card to everyone. So giving those vaccine cards, like an immunity passport or something like that, that would help a lot and increase the vaccine program. And yes, there has to be a uniformity, whether it is at the government center or at the private sector. Keep it open for everyone wherever they want to go.
My argument would be, yeah, that's a good idea of that immunity card, and somewhere that reminds me of what happened with Aadhaar, right? There was a lot of debate around Aadhaar, and then pretty much today everybody is in Aadhaar because you needed to show your Aadhaar to get any work done. Dr. Parker, yes, I take the point about the lack of equity, but even with that, should we move towards that kind of system where increasingly you're going to need what Dr. Sonia is calling your vaccine card to just live your normal life?
Absolutely, Barkha. There has been, since time immemorial, a saying that health is wealth. I think we all have to now get out of our slumber and realize that. And I think if the governments or in the federal government also, they understand that investment into this vaccination is going to solve many of the issues that are there. I think, and it should be kept available across the board, whoever wants to, wherever one wants to. If that we can achieve, I think we can do that. If we can achieve our, the voting rights
Yeah,
into the
but should the private,
remotest of
but
places,
why are
I
you
think why
against
not
reducing?
vaccinations?
Why are you against reducing the vaccine quotas to private hospitals that aren't able to use them, Dr. Parker?
Uh, well, I really fail to understand, and it's beyond my understanding as to what are we achieving by not giving the percentage of quota that is
We
required
we can give those
to
vaccines to other
protect the
people in
patients.
places where they're
You
needed
you mean to
more.
you mean to say we are not rendering our services? You mean to say
No, it's
that
not a judgment of the private hospitals. It's just the way the vaccine rollout has taken place, the gap between the two doses,
yeah, but
the
are
fact.
we to be blamed for that?
No, no, to take
Then
away the
if
vaccines would not be a
if
judgment.
the
It would
three
not
chief
be a black
ministers are
market.
talking about it, I don't think I want to rationalize and I want to understand. It's beyond my perception, beyond my understanding, and I think it hits your basic common sense. Come
I'll
on.
tell you. Let me try and answer that, or let me get one of the guests to answer that. Dr. Pinto, I think one thing is that it's not a failure of the private system. Nobody is saying that. It's just a way of more evenly distributing the vaccines where they are needed the most, so the country as a whole can emerge out of the situation quicker. Why would the chief ministers otherwise even argue in favor of it?
No, I think what's, like most questions, I think the answer will be in the data. We really need to know why they are not getting utilized. And if it is
Yeah.
hesitancy, then all the incentives that you just mentioned will need to be, we need to think about behavioral methods to improve the utilization of those vaccines. If it is not hesitancy, if those who are eligible and willing to pay, all of them have received their doses, and these are just lying around for a want of people to take it, then I think a more dynamic process, like was mentioned before, where you can somehow return these doses which are not utilized, or identify centers which are consistently underutilizing those vaccines and take it away from them and redistribute them to the public sector, totally makes sense.
Dr. Mittal, none of you have taken my original question. Should the vaccines be taken away from the private sector? Are we gaining anything by keeping them in the private sector?
So I think, Barkha, this is a dynamic process, and I do think at the moment there is no justification for us to sort of stock vaccines when they are not available to so many, fellow Indians. So I think it has to be dynamic, and as mentioned by so many of my colleagues, that if there is underutilization in a particular hospital or center, that supply for the next week or whichever way it's done should be curtailed, and that should be pumped into the government sector. That which has come going back will be a long process. What Harsh was suggesting will run its own bureaucratic sort of framework. But at least the supplies that are coming in now should be tailored based on what has been utilized. And
Harsh, last, yeah, sorry, complete your point, Amrish.
I'm just saying that, and the rest should straight away go into the public system. This 25% shouldn't be a static
Fixed
no,
thing. Yeah.
no.
But Harsh, to your proposal that the state can or the government can buy them back from the private sector, there will be then a negotiation over that pricing, because the government is probably, please correct me if I'm wrong, is the government paying the same price that the private sector is? No, there's differential pricing that the government will say, why should we pay these prices?
See, the only way, the point you make is very, very valid. And that's the reason why 25 and 75% has been worked out by the government with the manufacturers, where the 25% are to pay, in a sense, to subsidize the 75%. That is
Yeah.
differential pricing. Now, what happens when the private sector doesn't pick up 25%? I mean, we want to, but if, as has been already said, already the government has a dynamic process. If you inject 1,000 jabs this month, you can take 2,000 the next month. But if you inject only 100, you won't get more than 200. So that process is already in. But look at the consequence if the private sector picks up, say, 10% in the next 6 months instead of 25%, then what happens to the manufacturers? They've been told 25% will go to the private sector. So you sell to the government at 150, 200, whatever may be the price, and the private sector is going to pay, 3 times or 6 times of this.
Yeah,
Now,
that's
the
why it's
private sector doesn't
complicated.
think
That's why it's complicated. So, what's the solution? One solution I'm thinking
No,
of as I'm listening to you.
the problem, Barkha, let me just take 10 seconds to complete.
Yeah,
The
yeah,
problem then will be that either the manufacturers will have to take more per dose from the government, or they are going to stop manufacturing in the long run because they cannot get the profits that they are looking for at a 75-25% formula.
And I was just thinking while I was listening to you, and if anyone wants to take this, like maybe one of the ways is to say to private corporations, if you want to open up your offices to restaurants, to malls, it's on you to pay the market prices and get everybody, all your employees vaccinated. There has to be some out of the box thinking here, right? There has to be some. Harsh, do you want to take that? Yeah, Harsh.
I'll take that. See, there is a suggestion that CSR funds of large corporates be used for vaccinating their entire workforce and even more. Why not? And this is a suggestion that has been mooted by the central government. It's a very, very valid suggestion because CSR funds being allowed to be used for vaccination. In fact, I would say they should be mandated that for the next 1 year, all CSR funds, say 50%, would need to be spent on vaccination, whether for your own employees or for their families or for the larger community. And if that is done, then see, just remember that without the private sector, you cannot achieve that target of 8 million jabs a day or 10 million jabs a day, which we need to be reaching the target of universal vaccination of the adults by the end of the year. So the private sector is very, very important for that.
And I need to close now, but I think thank you for reminding us that there's also an economics to vaccine production. And even if you put those vaccines back in the public health system, who's going to pay that differential pricing? The government has to be ready to pay it. If the government isn't ready to pay it, the vaccine manufacturers may not be able to produce at that rate. So this really does need the kind of out-of-box solutions. One could be CSR funding spent on vaccines, and whether we like it or not, we are now looking at an age of vaccine mandates. That is what I believe is inevitable. I don't see any other way out of this because it is absolutely kind of unjustifiable. I think, as all of you agree, that while some pockets of the country need vaccines, there are centers where the vaccines lying and they're just not getting used. So we will all apply our minds to this. Thank you, Harsh, Amrish, Dr. Peter, Dr. Parker, Sonia. Thank you. And to our audience, thank you. And please, if you have access to a vaccine, go and get a jab. I say this every day. Please do get yourself vaccinated. Thank you for watching. Goodbye.
Thank you.
It's great to see you here. Thank you for watching our work. If you haven't subscribed yet, don't forget to click the bell icon and subscribe to Mojo Story and support independent, robust journalism.